Mr. C. Padmakumar, President TMA, and Wing Commander Ragashree Nair, Secretary-TMA. We have Ambassador T.P. Sreenivasan for the welcome address.
Veena George, the representative of the World Health Organization, Dr. Ritu Singh, President of TMA, Sri Padmakumar, Honorary Secretary, Wing Commander Ragashree, and Marshal Vipin, and other participants and friends. You know that I am an invited chairman of this conference. When you are an invited chairman, there are some advantages. One, you have no responsibilities. Second, there is no payment from either side. If that is successful, I can take all the credit. If there is a problem, I can escape by the window. So these are great advantages. In fact, I have another assignment similar to this, the success of which is not yet announced. So today, we are in a happy position to announce success, having attended these 2 sessions. I think it has been an amazing experience. The kind of things we discussed, the kind of conclusions we reached were never anticipated, because everyone came to this conference with one objective, that is how to promote the One Health concept. But you will be interested to know that this One Health concept is not at all new to us, because we have a governor who keeps praying at the end of every speech, Loka Samasta Sukhino Bhavantu. That is the definition of One Health, isn't it? Just Loka, not just the people. So that is the advantage that we already have. So what we are really doing is to reinterpret what we already knew. And then to bring it into practice, we have made tremendous amount of discussion, and we have been able to come to several conclusions. What are the successes of this conference, if I may be allowed to spell it out? First of all, the TMA broke its glass ceiling, as it were, by organizing a conference on something which is very new and not normally associated with management. So by entering this new field of health and having created a consensus on the basis of the discussions, I think TMA can now move on to various other areas, not confined only to management. That is the first success of this conference. So in future, we would see that TMA might discuss governance, for example. It may discuss public policy, for example. It may discuss art and culture and literature, for example. So there again we have a combination of various aspects. So we are no more specialists. We are all going to integrate understanding and knowledge. And that is one important achievement of this conference. The second is we got the right people to participate. This, I think, particular gratitude should be expressed to Air Marshal Vipin, who has worked on this list of speakers for months together. But finally, sitting through the discussions, he found the right person for everything, starting from the governor, who was initially rather reluctant to come because he was here last year too. But we made a special appeal to him and he changed it and came here, because we were able to persuade him that his own understanding of this issue was very significant for the conference. And for the valedictory, who else can we get better than Veena George? Not only the Minister of Health, but also a very eminent journalist. Last time I saw her, she was a journalist, and today I'm privileged to see you as a minister. And we all know that she took up this position at a time which was very critical to health in Kerala. The transition between the pandemic and normal life. We have still not reached normal life, but she has handled that transition extremely well, and we are all grateful to her for what she has done for the state. Our President, of course, has been a guiding light for all of us, and he has taken us through this experience with great aplomb and great dignity. And then last but not the least, Wing Commander Ragashree Nair, who you saw everywhere, shedding light, giving us all the encouragement, and of course doing all the right things at the right moment. So I'm very privileged to welcome all of them onto this valedictory session, and I hope that we will have another review of what we have done so that we can go home today with the satisfaction of having done something for One Health. Thank you very much.
We have Air Marshal IP Vipin to sum up the event.
Kindly accept a floral tribute for them, Ambassador Sreenivasan, Minister, President TMA, Madam Chauhan, and Wing Commander Ragashree. Our next speaker is Air Marshal IP Vipin, retired. I will hand over to Jisha to briefly introduce him.
Honorable Minister for Health, dignitaries on the dais, distinguished speakers and panelists, media members, ladies and gentlemen, a very good evening to all of you. The curtains will soon fall or come down on yet another convention of Trivandrum Management Association, TRIMA 2024. Over the last 2 days, we have had intense discussions and deliberations over the theme One Health. That must have become a cliche almost with all of you now, but a very relevant one. I shall now run you through the proceedings so far and the takeaways therein. Firstly, let me congratulate the winners of various awards on a variety of fields that was awarded by Honorable Governor yesterday. Many congratulations to all of you. Well done. TMA wishes you many more laurels ahead in times to come. That, ladies and gentlemen, attests to the commitment of TMA to reach out to all the sections to encourage pursuits of excellence as brought out by Secretary in her activity report yesterday. Chairman TRIMA had outlined the goals and objectives that we set for this convention yesterday. I shall come to that as we go by. First was the inaugural session yesterday where the governor spoke extensively on One Health and what existed in our texts and scriptures way before the concept was publicized in Western media and thereafter traveled to us. And it is evident from yesterday's discussions that understanding of One Health among people is not to the desired level today. There is an urgent need to increase awareness of the significance of One Health. The first session, that's the towards the One Health ecosystem. On the screen you have the speakers. The first session delved on the subject of bringing everyone converge together to understand what One Health is all about. Like I said, coming from varied background, varied fields, there was a need to kind of set everyone on the same page to know where we stand, what and why of One Health. That was the intention of this session. And the speakers deliberated on the biodiversity laws, the biggest drivers of infectious diseases, traditional knowledge, and so on. As per the studies by a UN expert body, Zoonotic diseases account for about 75% of the emerging and re-emerging infectious diseases. This has led to about 2.5 billion deaths and about 2.5 billion infections and about 2.7 million deaths. Obviously, that's a very high number, and the study calls for an urgent need to manage zoonosis. Our second session, which is epidemics, pandemics, prevention and preparedness, dwelled intensely on that, which was a panel discussion moderated by Professor Dr. Marthandra Pillai and the speakers as you see on the screen. They brought out the skewed animal vet ratio, where for 130 crores human, there is an equal amount of animal constituency, yet we do not have adequate vets to take care of these. And they also stressed the need for an interdisciplinary collaboration and dialogue between departments for mutual health issues. The second speaker, Dr. Madan, brought out the need to be prepared for pandemics to come, and they have conclusively suggested that pandemics, we have not seen the last of pandemics, and we need to be prepared. And our health system, administration to healthcare workers, to right down to the last, including the community, need to be absolutely prepared for pandemics and take preventive measures. According to the Constitution of World Health Organization, health is a state of complete physical, mental, social well-being, and not merely the absence of diseases or infirmity. Dr. M.R. Rajgopal stated this today. The session on One Health and Wellness provided us the benefits of holistic treatment and how today the lifestyle diseases of diabetes, depression, anxiety, insomnia, and many others have come to fore purely because of lack of awareness, lack of involvement, and our apathy towards treating health issues. Government of Kerala is seized of the health sector and health issues and have taken steps to incentivize ventures and initiatives on this aspect. Yesterday you had a session by Mr. Harikishore, who is a director of KSIDC, and also he is a director for industries and commerce. Now, why I mention industries and commerce and other departments is One Health does not necessarily remain limited to health department. It has got many ministries that have to be integrated and dialogue to ensure that there is a smooth addressing of One Health issues. A study on Earth.org, they have brought out the 5 biggest environmental issues in India in 2024. And they are air pollution, food and water shortages, waste management, and biodiversity loss. The session on water conservation, waste management, and One Health yesterday was an eye-opener for most of us who were present at the convention. Mr. Anand Maligawad, who is now a renowned lake conservationist, you would have heard him, how passionately he had rejuvenated so many water bodies and lakes in not only Bangalore, all over India, and how he is getting to this mission right across the world. So we have such celebrities who are there with us, who are looking at rejuvenating the ecosystem, which is so important for One Health. The other speakers yesterday brought out how they are involved in their own ways to ensure that the waste are segregated, collected, and the normal population kept away from handicaps of accumulation of waste. Despite that, they did come out with the problem that Trivandrum does not provide somebody, one of the venturers, space enough to put across a facility for waste segregation and management. They also brought out the need to address the plastic waste and the associated hazards to marine and environmental ecosystem. Having seen the downside of One Health and all the issues yesterday, today we looked at something more positive. We looked at the positive aspects today. The session on future of One Health, innovation and opportunities clearly brought out that if we are ready to act, there are many opportunities and solutions that can open up. The panel discussion moderated by Ms. Hegde and other participants really brought out that opportunities in India for scientific research in the fields of One Health, AMR and so on are alive and they are attaining maturity. We also have a robust industrial and technological ecosystem to produce vaccines, research on epidemiology and so on. And Dr. Jayapal, who is an active advocate of technology into healthcare system, spoke of use of artificial intelligence and robotics into specialist healthcare. And in the final session, we took a closer look at our dear state Kerala and how One Health in Kerala are related or how well they are married. What has been brought out by the first speaker, Padma Shri Dr. Rajgopal, he very passionately came out very loud and clear in how we are entitled to a dignified life during our winters of our life. That's a right of every citizen. And very often neglected, with very few people taking care of old age. There is a need for individual and community participation for better quality of life, not only in the prime of life, but also in the winters of our life. Mitigation of risk of population density, forest cover, old age, migrant labor, dietary changes, stressful life, etc. have all been highlighted by other speakers. Now, all work and no play makes Jack a dull boy is an old adage, and I think I must quickly rephrase it, being gender sensitive. All work and no play make anyone dull. So we have had two sessions, a quiz and the World Cafe in an interactive mode, very playfully conducted and very engaging, and they have come out with excellent results and ideas, which I hope I'll be able to kind of show you in case it comes up. So in the World Cafe, here is a statistics on whatever all of you have participated in. Half the people in this august audience feel that 50% relate to interconnectedness of One Health. And that's the first learning that everyone has acknowledged. It's a great thing. And it seems very equally divided in the next two, global cooperation on One Health and seriousness of zoonotic diseases figure the next 25%. And people who have committed to action, they said that they would be spreading the awareness of One Health. That was the last session that has been said. Better waste management effort will be put in by people, and they would engage in dealing with AMR. What a wonderful thought, and notwithstanding my position as of now, I would genuinely salute you and thank you really very much for all the response. You've been wonderful. I'll be failing in my duty if I did not mention Ms. Divya Pradeep, the accomplished Mohiniyattam exponent who gave us all a great and memorable experience with her exceptional performance last evening. I would put my hands for her, and in absentia though, we acknowledge what she has done for us. Finally, before that, the convention also provided us the opportunity to meet and greet some of the wonderful people who are present out here, and we would definitely cherish our interaction and association for times to come. I hope all of you take this as one of the takeaways from this convention. And I would like to leave you with two thoughts that we could not adequately discuss, but nevertheless will assume importance in coming years. They are the emotional health and the spiritual health that would come into focus in coming years for sure. Alongside the medical side of the health, which cures diseases and looks after our health in particular, spiritual health and emotional health are going to help us in finding solution to wellness. And those issues that are behavioral aberrations that are cropping up today, to name a few, say drug abuse, intolerance, violence, and so on. Take it as a food for thought for your coming days. With that, I wish all of you very well and success in all the endeavors and all the things that you have promised that you do. Let's put the best foot forward in pursuance of One Health. Thank you very much.
Thank you, Marshal Vipin. She was an active SFI member and also the chairperson, Content Development Committee, Sabha TV. The first lady to hold the post of Executive Director of a Malayalam news channel, and having worked with prominent television channels like Kairali, India Vision, Manorama News, Reporter, TV New, etc., has anchored Nam Munnota, a weekly debate program of the Chief Minister, and was one of the 5 media personalities selected from India by US State Department to report US President's elections held in 2012. Ms. Veena George, Honorable Minister for Health and Women and Child Development, we welcome you and eagerly await to hear what you have to say.
Good afternoon. Distinguished personalities on and off the dais, Ambassador TP Sreenivasan IFS, Air Marshal IP Vipin, Dr. Ritu Singh Chauhan, Mrs. A. Bhuvaneshwari, Sri C. Padmakumar, Mrs. Ragashree Nair, dear brothers and sisters. First of all, I would like to thank you. Thank you for this invitation to take part in this annual convention of Trivandrum Management Association 2024. I was wondering why Trivandrum Management Association selected such a topic like One Health. For these years, we were, especially health department, we were continuously talking about One Health, especially after Nipah, COVID, and other infectious diseases. And I'm so happy for you, and I would like to congratulate the office bearers of Trivandrum Management Association for choosing this topic, One Health. And I'm so delighted to learn that you had a very good discussion on different topics related to One Health. So One Health, as you all know, it recognizes the intricate connections between human beings, human health especially, animal health, and environmental health. It embodies a philosophy that the well-being of each component of the nature is interdependent on others. So the basic concept is that human health is not an independent one. One Health is not just a theoretical framework, but it's a practical, actionable approach that can significantly impact global health outcomes. It's a universally accepted concept, and it helps in improving the quality of life of human beings. The idea is to identify the interrelationship between humans, animals, birds, plants, and the environment in which we belong, and achieve improved health levels through necessary interventions. Zoonotic diseases like Nipah, as you all know, bats are the natural reservoirs of Nipah virus. We could not yet identify how the exact spillover process is happening. That's how this virus is getting transferred from bats to human beings. ICMR is working on that since 2018. The team is in Kozhikode and in Wayanad, but that exact spillover process is not yet clear. And mosquito-borne diseases like dengue and chikungunya, etc., are some of the real challenges we face. And you might have read about the avian flu H5N1. So 3 districts, Alappuzha, Kottayam, and Pathanamthitta, now have avian flu outbreak H5N1. And scientific world experts tell us that if this virus is getting transferred to human beings, this is something which is going to be very disastrous. Last year in 2023-24, across the globe, around 800 cases were reported, H5N1 cases in human beings. Luckily, not in Kerala till now. And today I had a meeting with my officials in the health department, and we are having new outbreaks in areas like Kuttanad, Niranam, and other parts of Alappuzha, Kottayam, and Pathanamthitta districts. So we are very careful that the virus mutations can happen. It's very rarely that this virus gets transferred from ducks or birds to human beings. But last year, as I said, we had 800 cases, and we are closely observing and monitoring the situation. And if the mutations occur in virus and if it gets transferred to human beings, it will be disastrous than COVID-19. So we have certain challenges in Kerala that we face. The high population density of the state, and the travels of our people, the increase in the number of elderly people. It's not a challenge, it's an outcome of our public health activity, the good public health activities we have, and the vast forest cover, all are major factors that increase the risk of infectious diseases in the state. In view of such situation, Government of Kerala has decided to implement One Health program in order to improve the quality of health in the state. So what we were doing is that we have specifically rewritten all our health policies based on this One Health concept. And one such good example is the Public Health Act. Even after the formation of the state of Kerala, where we had 2 laws, one for the Travancore-Cochin area and one for the Malabar area. So these 2 laws were here in Kerala, and recently, last year, Kerala Legislative Assembly has passed the Public Health Act. So we have rewritten the basic concept. Earlier in the Travancore-Cochin Act and in the Malabar Act, it was like the medical officer will be the officer in charge. But in the new law, which our Legislative Assembly passed last year, we have rewritten it in such a way that The public health officer will be the medical officer, but there will be a team at the local level, at the local panchayat level. And that local team includes the agriculture officer, the officer from water authority, the officer or the representative of animal husbandry department, and the panchayat president will be the chairperson of that committee. And at the district level, we have a similar committee at the district level, and all the departments, including the animal husbandry, water authority, pollution control board, everyone will be there in that committee. So this is a change that has happened in Kerala in recent years. We, as our ambassador has told, our visions, our concepts are based on One Health, but we decided to rewrite all the policies based on this concept of One Health. So our health is not isolated. The phrase One Health, all for one and one for all, reflects a holistic approach to health that emphasizes the interconnectedness of human beings, animal and environmental health. The One Health concept recognizes that the health of the people, animals and ecosystems are deeply intertwined, and addressing health issues addressing the health issues requires collaborative efforts across various sectors and disciplines. I would like to bring to your attention some points specifically. And we all know that about this rabies virus. So the animal husbandry department of our government has conducted some wonderful studies, especially their PALO team. And they have found that the viral load in animals, other than dogs, is quite high these days, especially in cows, in foxes, and all other animals. The viral load, the rabies virus load is very high. So last year, you are all knowing about that. We in Kerala, we have more incidents of dog bites, cat bites, etc. And we had a study on this, why this is happening. Because health department is worried more about the health of the people, and we have to provide a IDRV, we have to provide the equine. So when you take the data, we understood that the number of dog bites and cat bites, it's increasing in the state. So we had a study based on this, and that study revealed many things. And one point of focus, or one point where we have to focus, is this area where not only the dogs, but also the other animals like cows and other pet animals and foxes, even in the forest areas, they have more viral load recently, and they are continuing their studies why this is happening. So diseases like COVID-19, which originated in animals, vividly illustrate the direct link between animal health and human health. There are several instances where the point has been reiterated, such as in the case of Nipah outbreaks. Similarly, environmental degradation can lead to new health challenges for both human beings and animals. Therefore, it is imperative to adopt a holistic view when addressing health issues. We should have a collaborative approach, a multidisciplinary approach. It's not enough for doctors, for veterinarians, for ecologists, or for public health professionals, but we need to foster partnerships and dialogues among these diverse fields. For instance, to combat the zoonotic diseases effectively, veterinarians and doctors must work together on surveillance, prevention, and treatment strategies. We can develop more comprehensive and effective health interventions by breaking down these professional barriers. And One Health should be a shared responsibility. And that's where I would like to congratulate Trivandrum Management Association once again, because all the policy makers, all the influential groups should acknowledge the importance of One Health. And this should be there in policy making, in planning strategies, in planning developmental projects. So this is something really great, and I strongly believe that you have created a history and you have created a model for others. Policymakers must craft regulations that consider health impacts on human beings, animals, and environment. Health professionals should embrace close disciplinary collaboration, and each of us as individuals can contribute by making environmentally conscious choices and supporting policies and practices that promote sustainable health. You might have read about the articles on Nipah by Reuters. So I had their experts came to my office. I had discussions with them at Kozhikode while the Nipah outbreak was going on, and they were asking me about this particular issue. So they are pointing out, because they are pointing out that these places were the habitats of bats, and they were forced to leave those places, and years after that cutting down of trees happened, these bats, changes have happened in the total ecology, in the total ecosystem. So, and we were wondering why this spillover is more in recent years. So Reuters, one of the assumptions of Reuters was that, but ICMR or Indian experts were not agreeing on that. So ICMR, we had a good discussion with an ICMR and experts from NIV. So hopefully we will be having certain conclusive things, or we will reach some conclusions this year in 2024 regarding the spillover events. And also one important thing is that our solutions for problems must be sustainable. This means considering the long-term impacts of our actions on all aspects of the ecosystem. Sustainable agriculture, for example, not only supports human health by providing nutritious food, but also ensures animal welfare and protects environmental health. Reducing pollution, conserving natural habitats, and mitigating climate change are all integral to the One Health approach. These efforts will ensure that we protect the health for future generations. And I'm not going into the other aspects because seeing these topics of the discussion, I think that you all had a look into this different points related to this particular issue. And in Kerala, Government of Kerala has started a One Health Institute, and with the help of World Bank, we are trying to train the community volunteers. So whenever a change happens in the ecosystem, the community volunteers can identify, they can acknowledge that change. They can, if they have the concept, or if they have that idea of what's happening in the ecosystem, so they can acknowledge it and they can report it to the authorities, and they can communicate well to the people of the community. So far we have trained around 250,000 volunteers in different districts of Kerala, and we have established a One Health Center here in Trivandrum, and we have a One Health Center particularly on Nipah research at Kozhikode. In conclusion, One Health, all for one and one for all, is more than just a slogan. It's a call to action, a reminder that our health is intertwined with the health of animals and our environment. By embracing this approach, we can build a healthier, more resilient world. Let's commit to working together across disciplines, sectors, and borders to make this vision a reality. Our collective efforts will lead to a brighter, healthier future for everyone. Thank you very much.
Dr. Ritu Singh Chauhan, Technical Officer, International Health Regulations, World Health Organization, Health Emergencies Program. Dr. Ritu is an international health expert. Welcome, ma'am.
Minister for Health, Women and Child Welfare, Madam Veena, Chairperson, Secretary, Convener, TRIMA, experts, private sector colleagues, ladies and gentlemen, and my dear young friends. I'm very, very pleased, and on behalf of the World Health Organization, I thank you for giving us an opportunity to be here to share with you some of our thoughts. I have a few slides, so if somebody can project. Yeah, okay. So, friends, as we all know that recent international public health emergencies, and we have all seen the impact of COVID-19, but also monkeypox, Ebola outbreaks, Nipah, of course, in India, and continued threats, including that of antimicrobial resistance, and foodborne challenges in particular demonstrate the need for One Health approach. And I think these last 2 days have seen many stellar presentations on this subject, and we have seen that there is need for continued investment and focus in terms of building resilience towards some of these threats, not only at global level, but also at national and subnational level. And in particular, Madam, I'm very pleased at the efforts Kerala is making to advance One Health capacities. As we all know, the threat of future pandemics from diseases of animal origin is extremely serious, and we must be ready. And in line with this, states must maintain a vigil for disease X preparedness and have well-oiled systems and capacities in place to respond as well as learn from some of these events. If the pandemic has really taught us anything, it is that we are stronger together. And I would like to take a minute and quote what our Director General, Dr. Tedros, said to the World Health Assembly. The COVID-19 pandemic is a reminder of the intimate and delicate relationship between people and planet. Any efforts to make our world safer are doomed to fail until and unless they address the critical interface between people and pathogens and the existential threat of climate change, which is making our Earth less habitable. So this is really a call to action for One Health. And we also know that the world remains rather unprepared for large-scale health emergencies. We have seen that with Ebola, we have seen that with COVID, and we know that if and when there were to be a next pandemic, the world is not yet ready. The world is at the moment discussing how the international health regulations, which is the only legal instrument for global health security, can be made stronger as a legal instrument to protect global health, but also in terms of are we ready to face the next pandemic? And we know that there are systemic capacities which need to be built. And therefore, when we talk about One Health, we are not only talking about animal health, agriculture, environment, and health systems. We are also talking about economics, we are talking about financing, we are talking about social welfare and protection, and we are also talking about concurrent disasters, as we know that in India itself, when we have floods, we also have zoonotic events that sometimes follow. So when we are really talking about building resilient health systems, we are talking about strengthening primary health care. And I think there were some reflections in this workshop also about how do we strengthen. I think Madam has already mentioned the emergence of H5N1. It's something that we need to be constantly looking at. And we have had national workshops on pandemic preparedness, but I think states also need to review what is their capacity. We have continued risk of Nipah and other high-threat pathogens. Again, for MERS, we have had recent cases in Saudi Arabia, and we also know that with climate change, the vector-borne diseases will continue to be important threats. And these are some things for which we need to be ready and prepared. So we are trying to look at various initiatives to strengthen public health preparedness and response, and in line with that, the state of Kerala would benefit from looking at some of these important visionary documents that have been prepared at WHO Southeast Asia regional level, but also at global level, which talk about PRET, which is a new approach to respiratory pathogens. We are also working towards improving our understanding of predicting epidemics and pandemics, and we have a whole new hub which has been set up in Berlin for predictive analytics and better intelligence. And this is something which we know and realize it's going to be really important. In fact, the review after the pandemic has shown that there were about 200 plus recommendations in which what needs to be done to make the world better and ready for the next pandemic, and One Health and capacity building for One Health particularly has scored very high in terms of the kind of recommendations that we have seen. So our vision is to have a resilient health system which should be able to prevent, predict, detect, and respond to health threats. And each of these words is extremely critical. We often find that sectors do come together and partner during outbreak responses, but how can we have sectors working for preparedness, for prevention, for detection? Early detection is something we need to look at. So we are working at the global level to have a better collaborative intelligence where agencies, sectors, ministries, state, non-state actors, as well as experts can come together so that our communities are ready and prepared, and there is a whole new global health architecture which is being drawn, which is hinging on the principles of governance, systems and financing, but also looking at collaborative intelligence, community protection, emergency coordination. And this is the most important tool that we have from WHO right now, which is the One Health Joint Plan of Action, which has 6 action tracks, and we are recommending that countries look at this One Health Joint Plan of Action to review how they are going forward in terms of their One Health systems and capacities. So these action tracks range from strengthening health systems to also looking at zoonotic diseases, neglected and vector-borne diseases, food safety risks, combating AMR, but also very importantly, integrating the environment into One Health approaches. I think we had some reflections of that during I think this workshop has really shown that we can bring different kinds of actors together for a comprehensive review of One Health threats, and where we really talk about analytics and evidence, because this is where the science is. Without the evidence, we will not be able to move forward. So capacity building, strengthening health systems, multi-sectoral collaboration. And I think it's time we look at how can we have bridging workshops between different sectors so that the intelligence that exists in one sector can complement other sectors, and we can really look at how do we have better preparedness for One Health. So in terms of collaborative surveillance, we are talking about surveillance which should look at what is really happening on the animal health side, what is happening on the human health side, and sometimes the signal can be in one sector, but it can impact all the sectors. We are also talking about community protection, safe and scalable care, access to countermeasures, but also very importantly, emergency communication. So I'd like to focus now on what are some of the One Health actions which need to take place at country level, and some things which can inform the forward vision of Kerala itself in terms of as it moves forward for One Health approach. So we are talking about increasing the understanding and advocacy for health governance. We know that the understanding of One Health is still poor. We also know at our state level, the health governance needs to improve for intersectoral actions to actually take place. We're talking about accelerating implementation of One Health plans, better policies and strategies. We are also talking about building capacity, not only in terms of looking at One Health threats, but also jointly assessing the risks. So where should Kerala be investing further for building its resilience to epidemics and pandemics? Definitely collaborative surveillance, better intelligence, data analytics, because a lot of information exists, but it exists in silos. We need better technical insights and more periodic One Health risk assessments. We need to look at early warning and signal identification. Looking at strengthening genomic surveillance and laboratory networkings, hotspot mapping for One Health threats, interdisciplinary research. And there are very good tools available from WHO on how to conduct an after-action review once the event has actually happened, and how does that feed back into the contingency planning. We need periodic exercises, drills, simulation exercises, but we also need to work with our communities. And why is that important? I think without community understanding and engagement for zoonosis and One Health, we will not be able to reach the next mile. Communities can actually help us in reducing the emergence of these very important threats. Have their better understanding of risks can also lead to better risk mitigation measures, improvement in food safety systems, strengthen biosafety and hygiene sanitation, but also preservation of ecosystems. We saw how, Anand's presentation yesterday, how one man can actually make that much of a difference in terms of its ecosystem preservation. So we are really talking about moving from a reactive approach to a proactive approach, so that we have an early opportunity for nipping the outbreak just when it occurs or just when it's first detected. So this is the tool that we are also promoting for building national and subnational capacities for health security. It also has significant, layers of understanding for One Health. This is the joint external evaluation tool. Countries and states can look at this evaluation tool. There is an exercise that you can do first in-house, looking at we're bringing various sectors, discipline and experts together to do a self-evaluation. But there is also step number 2 in which you can bring an external team for validation of your findings. So there are various indicators in the joint external evaluation tool. I have just mentioned them here. But as you can see, all of them have ramifications for One Health, and therefore using tools such as these would be important for moving the country forward in terms of understanding and building its One Health ecosystem. So what is it that we need to start doing? More prominent inclusion of ecosystem and environmental components, and globally this has been recognized as a missing link in the One Health approach. So we really need to bring many different sectors, agencies and partners together. We need better understanding of how these risks are emerging. In particular, we are seeing big outbreaks of dengue, chikungunya, and because of climate change and some of the other climate sensitive diseases. And looking at combating AMR, which has to start from the communities itself, but also looking at innovations. And I think Kerala has many good practices to share with other states. We also need targeted investments to enhance the engagement and empowerment of frontline communities. And I'm really happy to hear the significant strides the state of Kerala is making in this direction. We need impactful awareness campaigns. We also need targeted interventions for high-risk groups. Not everybody is at the same risk for acquiring zoonotic infections. Our veterinarians, people who handle poultry, meat products, people who are looking at industry such as defeathering, skinning, handling, animal products, sewage workers. We need targeted interventions for these high-risk groups so that they can understand and better adhere to hygiene practices. In fact, globally, we are talking about improving practices in our wet markets because we know these are sometimes the hotspots of spillover of zoonotic infections. We need much more focus on strengthening infection prevention and control, risk communication, and building the knowledge base. And when we really talk about risk communication, we are not just talking about hands-on training, but we're also talking about crisis response. And we saw how during the pandemic, a lot of misinformation and rumors were also there. So just to say that there are multiple tools which are available from WHO which the state of Kerala can use to advance its One Health agenda. And I will end my presentation with this slide that please look at all the action tracks under the One Health Joint Plan of Action to strengthen collaborative surveillance. There are many high threat pathogens which the country and the states need to prepare for, and therefore this requires specific planning as well. Conducting after action reviews and implementing IHR at state and district levels. IHR and One Health needs to be everyone's business. It is not an option, it is a necessity. But the real challenge lies in the field implementation of it. We need to understand that One Health needs to be practiced by individual and in household settings, and it needs to be a citizen movement. Thank you very much.
Thank you so much for that insightful address, Dr. Ritu Singh Chauhan. Curtains are falling on TRIMA 2024. But getting here was backed by months of hard work, an orchestra of committees conducted by the chairman of TRIMA, Ambassador TP Sreenivasan, supported by President TMA and co-chair TRIMA 2024, Mr. Padmakumar, was hard at it. I invite the President of TMA, Shri Padmakumar, and co-chair of TRIMA to share the closing remarks.
Good afternoon, everyone. Honorable Health Minister, Madam Veena George, Ambassador TP Sreenivasan, Dr. Ritu Singh Chauhan from WHO, Marshal Vipin, Wing Commander Ragashree, past presidents of TMA, members of the managing committee, TMA members and delegates. It gives me a great pleasure to address you at the end of our two-day session. And I think we can look back with some satisfaction that this has been time well spent. You've already heard the summary, so I'm not going to get into that. I only have a few points to make. One, we had set out to try and make this a useful educational session. I don't know about the rest of you, but it's been very useful and educational for me. I understand a lot more about One Health than I did 2 days ago. I hope some of you at least will share that sentiment. One of the most useful sessions that I found, I mean, every session was useful, it was packed with information. We had some of the finest experts speaking about various aspects of One Health, was the one which just concluded before the valedictory session, which was World Cafe. And I think this is probably useful for us going forward. We need to take advantage of, slight innovations in the format where we can engage the audience. So let me come straight to the point. We've heard from the experts. I think we have a better understanding of One Health. And one of the things that TMA promised itself was that this is not going to end with this function where we all congratulate ourselves and then go home. But we actually come up not just with a report, because I know that many reports are collecting dust on many shelves. We will certainly come up with a report in the next 1 week. But we want to do a little bit more than that. And why do we want to do that? It's because we think that One Health actually is talking about the most important thing which affects all of us, which is our very survival. If we understand that, I think we will do the right things. So here is a short list of a few things that TMA can do. One, come up with a One Health action plan for ourselves for the next 1 year. Second, I have heard about WHO's One Health scorecard, and the whole concept looks very fascinating. I think it would be great to adopt this scorecard, in Kerala, and definitely we can try and start in Trivandrum. TMA has been focused on Vision 2025 for the city of Trivandrum, and one of the key pillars has been Clean Trivandrum, of which we have chosen to focus on waste management. And I think that we should continue to focus on waste management. One of the things that we learned in the discussions is just how important that is as a source of infection. And if we can address that, it's a small thing, but I think it's something which a lot of people are not looking at, is generally neglected, and therefore maybe we should do it. So on this note, let me thank every one of you, every delegate who has sat through these 2 days, all our sponsors, the media, and every member of TMA who put in so much hard work to make this a success. Once again, let me thank our chief guest for today, the Honorable Minister for Health, and also on behalf of TMA, Madam, we would like to assure you that TMA will be happy to work with the Health Department and the Government of Kerala, and please do use us as a resource. Thank you.
Thank you so much, Mr. Padmakumar, President TMA and Co-Chair TRIMA 2024. He ended on a note of thanks, and to formally deliver our expression of gratitude, I invite our dear Wing Commander Ragashree D. Nair, General Convener TRIMA 2024 and Secretary TMA, to do the needful.
Before I proceed to my formal duty, I just want that 3 of the MCs who were tirelessly working last 2 days to just give them a memento. So may I request Lakshmi to please step forward. Jisha, Dr. Jisha, may I request Ambassador TP to kindly hand over the... this is a certificate, ma'am, in line with the theme today. We are growing trees in Fatehabad. And our own Anupama Ramachandran, may I request President to kindly Honorable Minister, Ms. Veena George, Minister for Health, Women and Child Welfare, Dr. Ritu Singh Chauhan, IHR, WHO, Ambassador TP Sreenivasan, TRIMA Chairman 2024, Padmakumar, TRIMA Co-Chair 2024 and President TMA, Marshal IP Vipin, Co-Chair Program Subcommittee, past Presidents, MC, TMA members, invitees, awardees, delegates, students, ladies and gentlemen. Before I mention the next line, I want all of you to just concentrate on the screen. We had one theme, 2 days, 5 awards, 10 sessions, 300 plus delegates, innovative ideas, 25 plus volunteers, 20 plus crew, 30 plus speakers and 25 plus sponsors. That speaks a 10-star. Today, as we reflect on the success of TRIMA 2024, I am honored to extend my deepest gratitude to all who have played a pivotal role in making this event a resounding success. We begin by acknowledging the gracious presence of His Excellency, the Governor, whose inauguration of this event set the stage for 2 days of insightful discussion and enriching experiments. We are truly grateful for his support and encouragement. Our heartfelt appreciation goes to Minister Ms. Veena George for gracing us with her presence at this valedictory function, inspiring us with her words of wisdom and commitment to the cause of health and well-being. In the first technical section, though we have all heard the summary, we were privileged to have the Health Secretary share his expertise and insights, guiding us towards a deeper understanding of the challenges and opportunities in the field of healthcare. KSIDC MD enlightened how startups could get funding in scaling up in a healthcare segment. His presence was of value and we are grateful for his presence. A special mention goes to our various speakers, the late man Anand Malikawad, Quiz Master Nishint Anand, whose engaging quizzes kept us on our toes, added an element of fun and excitement to the proceedings. We were also treated to a mesmerizing performance by classical dancer Vidya Pradeep, whose graceful movement captivated our hearts and mind, reminding us of the beauty and richness of our cultural heritage. To our sponsors, whose generous support made this event possible, we extend our sincerest gratitude. Your commitment to our cause is deeply appreciated and we are grateful for your partnership. We also thank the press, media, Ravi Studio for their coverage and support, helping us to reach a wider audience and amplify the impact of our message. A special mention goes to our media partner Asianet Enterprise for their invaluable contribution to the success of this event. Above all, to our PR advisor, Mr. Rajesh, and his team for his meticulous planning of the press meet and coverage of the event, including the post-event plans. Our heartfelt thanks also goes to the dedicated members of the event management, Manju and Sanu's team, who worked tirelessly behind the scenes to ensure smooth execution of every aspect of the convention. Your hard work and dedication have not gone unnoticed and we are truly grateful for your efforts. Any event is a success if the delegate registration is seamlessly handled. We had a dedicated youngsters from Myogene, Naufal and Shuffle shouldering the responsibility. They cross-checked each and every aspect time and again and were extremely proactive. The reason any conference is held is to cater to the needs of the audience. Without the audience, the conference has no meaning. I extend my sincerest appreciation and gratitude to all the delegates who participated and patiently waited yesterday despite we running late due to prolonged sessions. I would like to extend my sincerest appreciation to Ambassador TP Sreenivasan, Chairman of TRIMA 2024, President C. Padmakumar and Co-Chair TRIMA for their visionary leadership and unwavering support throughout this journey. I also express my gratitude to various committees of TRIMA 2024 responsible for its success. First of all, the program committee, Dr. Jaishankar, Marshal, IP Vipin and Rohit Philip for planning the program so well. Mr. Rajesh, Invitation Cell, Mr. Sedhu Madhavan for venue and catering, Ms. Ragashree, Accommodation, Logistics, Mr. George Koshi, Delegate, Mr. Biju Prasad, Memento, Mr. Pradeep, Student Committee, Mr. Mohan Velayud. Your meticulous planning and execution have contributed immensely to the overall success of this event. To the past presidents and MC and all the TMA members whose guidance and unwavering support helped us to make this event a possibility. Last but not the least, a heartfelt thank you to the hotel staff and the Secretariat for their hospitality and support, ensuring that our guests had a comfortable stay and a memorable experience throughout their stay. As the curtain falls for this event, I want to express my deepest appreciation to each and every one of you for your contribution, dedication, commitment to the success of TRIMA 2024. Together, we have not only created lasting memories, but also made significant strides towards advancing the cause of health and well-being in our society. Thank you all once again for your invaluable support. Happy landings. Jai Hind.
Thank you so much, Secretary. Wing Commander Ragashree D. Nair. Please put your hands together for our Secretary, who was General Convener for the event, who was like a Commander-in-Chief, who made sure that all of us did an excellent job and all the delegates were happy.
As a token of gratitude, may I request Ambassador TP Sreenivasan sir to kindly hand over a token of gratitude to our Minister Veena George.
Ma'am, Veena ma'am, this is a certificate of trees being planted in your name. Sorry.
May I request Sri Padmakumar sir to kindly hand over a token of gratitude to Ms. Ritu Singh Chauhan. Thank you all.
हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मागे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे